I'm Dr. Emily Kakande, an ENT consultant in Mulago. Good morning, everyone. I'm here to talk about what the ENT department does in Mulago, which is National Referral. We run both clinics and theater days, work on cold cases and emergencies. We have two clinics that run, one in Old Mulago and another in New Mulago on 5th floor, Block G, New Mulago. Mondays is for head and neck. Those are neck masses. Tuesday is for children. Wednesday is for ears, which we call in ENT terms otology. Thursday is for the nose and sinuses. Thursday is a general clinic. Those are specialized clinics, and all the patients that we see in those clinics are referrals that have been already assessed in the Old Mulago clinic, which also runs every day of the week for first timers. So you come with your referral letter, referral medical record from the Old Mulago clinic, and then they tell you which day specifically to come in to see the specialist on the different days of the week. Now, after assessment has been done in the New Mulago clinics, if it requires treatment is then done after diagnosis. So diagnosis is usually clinical history, examination, and in the New Mulago clinic, all patients who are, for example, the nose, because I'm a rhinologist, are scoped with a telescope, which is called a rhinoscope. We look at the front of the nose and the back of the nose. Those in head and neck, there's a flexible little wiggly telescope that can be used in the head and neck clinic to look even down into the throat, the larynx, which we call the hypopharynx in medical terms, which is the voice box in layman's terms. After diagnosis is made, either investigations are sent for, so possible investigations that one can request for ultrasound, CT scan, those are radiological, but there are also hematological investigations that can be requested for, from a full blood count to liver and kidney function tests. Usually the CBC is, the full blood count is sent for, especially if someone is scheduled for surgery. So for the cold cases, all patients are sent for a full blood count, and those above 50 are sent for cardiological investigations, especially if they're elderly and hypertensive. Hypertension is high blood pressure. For those where it's an emergency, for some of them, they are sent for radiological investigations, which could be an X-ray, especially when it's a foreign body, and then sent down to the ward for admission. Once they're admitted on the ward, they are then transferred to the emergency theater, which is in casualty. There are some patients, though, who come in directly through casualty. For example, children who choke on foreign bodies in their windpipe, groundnuts, maize, some toys, or even nails. Those come through straight from casualty, which is the emergency ward for Mulago, and they are taken straight to theater after a radiological investigation is done in Old Mulago. So they are only admitted to our ward, which is on 1A ENT, after treatment is performed, when the foreign body has been removed. Apart from children, we also receive patients who have fish bones stuck in their throats, or for a few people it's meat or dentures. Those are the commonest emergencies that we receive, or those who can't breathe and we need to create an artificial airway at the front. For those on ward, they're prepared for theater for cold cases. If it wasn't an emergency, full assessment is done. Now, after surgery, which is in main theater, some cases are benign. Benign means not cancerous. Malignant means cancerous. For those, where it's discovered that is cancerous and tumor has been completely excised, or even if it's partially excised, for histological investigation, where a pathologist actually looks at it to confirm whether there is cancer or not. They are then referred to Uganda Cancer Institute. And for those that are non-cancerous, surgery is performed. It most times is curative if it's not cancerous, and follow up is done on the ward. But once they are discharged, once they are fit for discharge, they're supposed to come back on the day for the particular discipline. So if it's throat, inside the throat or outside the throat, for adults, which is Monday, they come back for a Monday clinic review, either a week or two, and they are told whether the condition will require further reviews or not. For pediatrics, the commonest operation is adenotonsillectomy, where the tonsils and adenoids are removed, and usually they have 1 or 2 reviews subsequently for the children. For otology, where people have chronically discharging ears, for some of them it's a one-off, and for others they need a lifelong follow-up. For the nose and sinuses, some people require just a one-off review. For example, those who have a fractured nose and it has been corrected. But for some, where some sinus diseases are chronic, they need follow-up reviews that are frequent, every 3 weeks or monthly, to make sure that the condition they were operated for does not return. Some of the major surgeries we do are endoscopic sinus surgeries, anterior skull base and lateral skull base surgeries, together with neurosurgeons, who are brain surgeons. And then we work both with ophthalmology, who deal with the orbit, and oromaxillofacials, who deal with the face and the bones of the face. So sometimes we team up with other disciplines to actually manage a single patient, especially when it's complicated.